This movie depicts the medical training provided to the Lupin Human Welfare and Research Foundation, LHWRF's paramedical staff working under Lives Healthcare Program. The program is colloquially known as Deshbandhu Jan Arogya Seva, named after LHWRF's founder, late Dr. Deshbandhu Gupta. The purpose of the training was to equip and improve paramedical staff skills and knowledge required for quality screening, diagnostic, treatment and management of hypertension, diabetes, ischemic heart disease, chronic obstructive pulmonary disease, COPD and asthma. This cohort's master instructors were medical academicians, specialist doctors and paramedical technicians from Mahatma Gandhi Medical College and Hospital.
We, Department of Community Medicine, Mahatma Gandhi Medical College, Jaipur, along with Lupin Human Welfare and Research Foundation, conducted a skill enhancement training program for prevention of non-communicable diseases like diabetes, hypertension, cardiovascular diseases, and chronic obstructive pulmonary diseases.
The training sessions consisted of 4 segments. A pre-test was administered at the beginning of the course to measure the understanding of the students. Following this, training sessions commenced. Part 1 of the training consisted of lectures on disease burden, risk factor identification and evaluation, signs and symptoms, and pathophysiology. Part 2 of the training consisted of hands-on instruction on assessing patients' vital signs, including blood pressure, pulse rate, SpO2, blood glucose, BMI, and respiratory rate. Practical demonstrations of patient screening and diagnosis are provided in the 3rd segment. For instance, a demonstration of the spirometry test was performed to teach trainees how to assess the functional capacity of the lungs and identify respiratory distress. The team was given hands-on training on how to operate on ECG machine by demonstrating tests like the electrocardiogram, ECG on stimulation dummies in patients. In addition to ECG, participants were shown how to perform and document the results of blood and urine tests such as lipid profile, blood cholesterol, serum creatinine, cardiac biomarkers, and complete urine analysis in a fully equipped live pathology laboratory. The objective of the 4th section was to educate the physician and pharmacist on pharmacotherapy for the cardiovascular and pulmonary systems. In addition to pharmacological therapy, the sessions also covered the indications, contraindications, side effects, and adverse effects of medicines used to treat and manage NCDs. Here are excerpts from the training.
So during these 15 days of training from 16 to 31, first we covered all the topics related to NCDs, a brief introduction about all the NCDs including diabetes, hypertension, stroke, COPD and cancer. We also gave the screening advice for what are the screening procedures for all these and developed a questionnaire for them so that we can screen in the field practice areas. And also the WHO steps for screening tool that is used worldwide. That was also taught along with the others NCD related questions, pathology and pharmacology, blood related sampling, collection, ECG, and also the spirometry, how to do the spirometry and ECG so that it can be done in the field practice areas. We also covered the NPCD CS program, which is the program that is running for all the NCDs in India.
डॉक्टर पेशेंट रिलेशनशिप पे हमने एक इंटरैक्टिव क्लास एंड सेशन लिया है. देन NCDs दैट इज़ नॉन कम्युनिकेबल डिजीज़ पे इनकी पूरी ट्रेनिंग हुई है. एंड आज हमने NPCD CS लिया, दैट इज़ नेशनल प्रोग्राम जो कैंसर कंट्रोल और स्ट्रोक के लिए होता है.
This training has prepared the Lives Program health workers to provide a variety of services at the health camp held at LHWRF intervention zones. We are extremely grateful to the Department of Community Medicine at Mahatma Gandhi Medical College and Hospital for collaborating with LHWRF on this training.